Assalamu alaikum, everybody. I hope you can hear me. Now, today we are going to talk about the bleeding disorders. Bleeding disorders. In normal physiology, you have come across a term hemostasis. If you remember, whenever we talk about bleeding disorder, the understanding of hemostasis is very important. Then the subject becomes very easier. When we say hemostasis, it means that there is a system in the body which helps in controlling the blood loss during trauma. Hemostasis refers to how is the bleeding is stopped when there is a trauma to the tissue or blood vessel. Again, I repeat, hemostasis means it is a subject which deals with the study of how is bleeding stopped when there is a tissue or vascular trauma. If you recall that hemostasis consists of multiple components. Whenever we talk about any system, we talk about its constitutions. We talk about its components. Number one, the basic components of hemostasis are, number one, the normal platelet count. Normal platelet count. Number two, that you have normal concentration of all the clotting factors. Number three, that you have a normal blood vessel. These three components are very important to be normal for a normal hemostasis. The platelets, clotting factors, and normal blood vessel. When we talk about bleeding disorder, there must be something wrong either with the platelets or with clotting factors or with blood vessel. So whenever we talk about bleeding disorders, you must keep in your mind that what are the normal components of hemostasis? The normal components of hemostasis are platelet, clotting factors, and intact normal blood vessel. Let us talk about the bleeding disorders which are concerned with platelets. A person will have bleeding disorder because his platelets are low in count. We have talked about platelets in our previous lectures, but just to recall that whenever we talk about bleeding disorders, person can have bleeding disorder because his platelets are low in number, or the platelets are normal in number, but they are non-functional. Non-functional. The non-functional platelets are often found in uremia. Person having renal failure will have uremia. In that condition, the platelets are non-functional. Otherwise, in most of the condition, these are the platelets which are low in number. The reasons or the causes of low platelets, which is also termed as thrombocytopenia. The causes of thrombocytopenia are, number one, they are destroyed in your circulation. They are destroyed in your circulation because the antibodies are formed against them. There is a disease called ITP, idiopathic thrombocytopenic purpura. We discussed it last time. Or you can have low platelets because these platelets are sequestered in spleen. And which is seen often in cirrhosis. Or platelets are overconsumed in a condition which is called disseminated intravascular coagulation. I briefly talked about DIC last time, disseminated intravascular coagulation. Let me repeat again briefly about DIC. DIC is a disease in which endothelium of microcirculatory vasculature, endothelium of microcirculatory vasculature is generally destroyed. The endothelium of microvasculature is generally destroyed. That will result into two phenomena. Number one, activation of the platelets, which are going to get attached to the site of endothelial injury. forming platelet plugs. And number two, activation of intrinsic clotting mechanism by activating factor 12, that is called Hagman factor. And of course, by any pathway, whenever clotting mechanism is started or activated as a cascade reaction, eventually fibrinogen is converted into fibrin fibers, which enmeshes the platelet plug, and that product consisting of platelet and fibrin fibers is called a thrombus. So in DIC, extensive in DIC, there is extensive endothelial injury to the microcirculation, resulting into extensive microthrombi formation, resulting into two phenomena. Remember, whenever there is generalized microthrombi formation in microcirculation, two things occur depending upon which phenomena is predominant. Number one, most of the clotting factors and platelets are consumed in this phenomena. Of course, whenever you have a lot of microthrombi formation, the platelets are consumed, over-consumed, and beside that, clotting factors are also over-consumed. That will result into decreased platelet number in circulation. That will lead to decreased factor. So such people, this is one phenomenon. Such people who are having DIC, they will have a phenomena of decreased platelet, and they will have phenomena of decreased clotting factor, predisposing them to bleeding. So the DIC people, any person having DIC may present clinically with bleeding from any site. He may have epistaxis, he may have petechial hemorrhage, he may have hematuria, epistaxis, etc., etc. Number two, in DIC, microthrombi formation will block the microcirculation, resulting into generalized ischemia. Of course, when microcirculation is blocked, it is going to lead to what? Hypoxia of the tissues. If this phenomena is marked in the brain, means that the microcirculation of the brain vasculature is blocked, the person is going to develop infarction of the brain. If this phenomena is seen in the lung, the person is going to develop a condition called shock lung. You can have tubular necrosis of the kidney. You can have infarction anywhere in the body. That is why DIC is a very lethal and dangerous condition. And once you have DIC, 80% of the chances are there to die. It is a dilemma. Having DIC is a dilemma. If you stop bleeding by giving platelet and clotting factor, it will accelerate the phenomena of further microthrombi formation, means further blocking of microcirculation. Or if you think of ischemia, and if you think of dissolving the microthrombi by giving anticoagulant, again the person is further going to bleed. So depending upon which clinical phenomena is evident in DIC patient, it depends upon the intelligence of a physician managing a patient of DIC. He has to determine which way is to treat. Anyway, that is why DIC is considered something very serious. Now, why you have DIC? Why you have endothelial injury in microcirculation means that we are talking about the causes. The most important cause to have DIC as a complication is septicemia, bacterial septicemia, and commonly by gram-negative bacteria. These are the gram-negative bacteria in which you have endotoxin release. These endotoxins, they basically damage the endothelial cells of microcirculation in generalized phenomena. So the moment you have septicemia by gram-negative bacteria, one can develop DIC. Second, the viral infection. The third, which often we see in Pakistan, and often people they die because of malaria. And remember, more than 2 lakh people in Pakistan, they die because of malaria, because of DIC caused by falciparum malarial infection. And what exactly happens in malaria caused by falciparum? It is generally said when a person has got malaria, at a time, not more than 1% or 2% of RBCs infested by malarial parasite. In majority of the people having malaria by falciparum, if you check their RBCs, hardly 1 or 2% of total RBCs are infested by malarial parasite. But in some cases, if more than 5% of RBCs, of the RBCs are infested by malarial parasite, which parasite? Falciparum, something happens. What is that something? The infested RBCs, they develop the tendency to stick to the endothelium of microcirculation. And they damage it. And microthrombi are formed. This phenomena of microcirculation obstruction by infested RBCs is marked in brain vasculature. That is why this condition is called cerebral malaria. But sometimes the microcirculation of GIT is also predominant affected area, and the people with falciparum infection, they come with acute abdomen. This is called algid malaria. Algid malaria. So these two type of complication which you see in Plasmodium falciparum infection, cerebral malaria and algid malaria, together they are called pernicious malaria, not pernicious anemia, pernicious malaria. Anyway, we are talking about how you have DIC commonly in population. The same phenomena of DIC nowadays is noted in COVID-19. It is believed that the COVID-19 damages the endothelium of circulation, microcirculation. Predominantly, this phenomena is noted in microcirculation of the lung. Just imagine what will happen when microcirculation of the lung is blocked by microthrombi formation. It means that the blood will not be oxygenated, and you have marked drop in oxygenation of the hemoglobin. Something very serious condition. This phenomena was previously not noted. We only thought that it was the alveolar membrane damage, but it was not alveolar membrane damage predominantly. It was the endothelial damage of the pulmonary vasculature. That is why the drugs like aspirin, the drugs like heparin help in the management of such patient. This is the clinical observation in various hospitals managing the COVID-19 in ICU. Anyway, so DIC can occur in many conditions. Somebody has got malignancy, extensive malignancy. Somebody has got lymphoma. Somebody has got sickle cell anemia. Yes, let me explain you, because the young people in USA, they are dying because of COVID-19 infection. It was in the beginning very surprising, but it was because those people having sickle cell anemia, whenever they develop hypoxia, their hemoglobin in RBC is polymerized. It is polymerized, and the RBCs, they become sickle shaped. These RBCs, when they are passing through the microcirculation, they develop a tendency to break or damage the endothelium. So this is another reason of DIC. Anyway, so we are talking about how platelets are decreased in circulation. The platelets A decrease in circulation not because of their overconsumption, like in DIC, not because of sequestration of platelets in spleen, not because of the antibodies are formed against them, like in idiopathic thrombocytopenic purpura, idiopathic thrombocytopenic purpura, but platelets are low in circulation because they are not being formed from the bone marrow. The bone marrow is not forming the platelet. The reason of not forming platelet in the bone marrow are two. There are two reasons that platelets are not being formed in the bone marrow by their precursor cell called megakaryocyte. Number one, the bone marrow is occupied or encroached by some disease. Bone marrow is occupied by some disease, resulting into decrease in megakaryocytes. That is why you don't have platelets in the circulation. What are those diseases? The most common diseases are neoplasia, malignancies, like leukemia, like lymphoma, or secondary metastasis in the bone marrow. They encroach the bone marrow, or some non-neoplastic condition like sarcoidosis. Or the bone marrow is not forming platelet because the bone marrow is suppressed. Bone marrow is suppressed by certain drugs, chemotherapeutic drugs, anti-cancer treatment. They often suppress the bone marrow. Radiation will suppress the bone marrow. Viral infection. Often, generally, whenever you have viremia, it is going to have an effect on the bone marrow. The commonest virus which is commonly found in Pakistan is dengue. It suppresses the bone marrow. And often these people, they come with decrease in platelet count. The drugs, beside anti-cancer drugs, the antibiotics, analgesics, they also have some of the antibiotics and analgesics, they have adverse effect on the bone marrow. They suppress the bone marrow. Besides that, the bacterial infection like typhoid fever may have an effect on the bone marrow. It suppresses the bone marrow. So all these conditions, you will have suppressed bone marrow resulting into thrombocytopenia. So once you have thrombocytopenia, clinically, it is going to have adverse effect on your hemostasis. Such people, they often present with tiny petechial hemorrhage, which are marked on the skin. Whenever such people, if they have thrombocytopenia, and if the count goes below 40 to 20,000, they develop petechial hemorrhage. How to make a diagnosis of Thrombocytopenia is very simple. You ask for blood CP, and one of the parameters of blood CP is platelet count. You'll find that the platelet count are very low. Once you find the platelet count are low, then you think of the diagnosis of the thrombocytopenia. Again, upon how you make a diagnosis of cause of thrombocytopenia, it depends upon your history. Now, we talk about the bleeding due to clotting factor deficiency. If you remember, the clotting factors are very important in the normal hemostasis. There are more than 12 clotting factors in your plasma and in your tissues, of course. They are labeled, if you recall, they are labeled as factor 1, 2, 3, factor 12, and besides that, there are some other non-labeled factors. They're called clotting factors. These clotting factors get activated and they have cascade reaction. If one clotting factor is activated, it will activate the other one. The common clotting factors, anyway, whatever you have clotting factors in your plasma, the basic aim of clotting factors activation is, remember, the basic aim of clotting factor activation is convert fibrinogen into fibrin. What is the main aim of clotting factor? By their activation, the final aim of activation of clotting factor is only one, and that is you must have conversion of fibrinogen into fibrin fibers. Normally you see, if you remember the normal hemostasis, fibrin fibers are very important component of thrombus. Fibrin fibers are very important component of thrombus. If you remember the definition of thrombus, a thrombus is a mass which is attached at the site of endothelial injury. It is attached to the vessel wall, which consists of mainly two main components. If you analyze the constituents of the thrombus, they only consist of two components. Number one, platelets. Number two, lattice network of fibrin fibers. There is a lattice network of fibrin fibers in which the platelets are trapped, and it is attached to the endothelial, injured endothelial site. This is called thrombus. And thrombus formation is normally seen whenever there is bleeding. So it is a life-saving phenomena thrombus formation at the site of vascular injury is life-saving phenomena. Otherwise, the bleeding will not stop. But if we have thrombus formation without vascular injury, without bleeding, this is something very dangerous. Because thrombus formation here and there will block the arteries and will lead to infarction of that particular tissue. Anyway, it means that clotting mechanism, the basic aim of clotting mechanism in normal hemostasis is to convert fibrinogen into fibrin so that the fibrin forms a lattice network in thrombus. I hope it is clear to you. So let us see clotting factors. How are they normally activated? If you remember your normal physiology of hemostasis, clotting factors are activated by two mechanisms. Intrinsic activation of clotting system, that is called intrinsic pathway. Extrinsic pathway. There are two pathways in which the clotting system is activated. In both pathways, whether it is extrinsic or intrinsic, finally what you need? Finally you need prothrombin activator formation. Prothrombin activator formation. In both cases, intrinsic and in extrinsic clotting mechanism activation, they terminate at one point, and that point is that prothrombin activation or prothrombin activator formation. Whenever prothrombin activator is formed, it will convert prothrombin, which is factor 2. It will activate a clotting factor number 2, which is called prothrombin, into thrombin. Thrombin, when thrombin is formed, this thrombin finally act on fibrinogen, and fibrinogen is converted into fibrin, which is going to be a component of a thrombus formation. It will make a clot. So one can have bleeding disorder because of the deficiency of clotting factors. Clotting factors. Now, the deficiency of clotting factors are grouped into two main sections. One is called acquired deficiency of clotting factors, This is an acquired phenomenon, and this is commonly seen in liver diseases. Whenever a person has got liver disease like cirrhosis or chronic renal failure, because most of the clotting factors are formed in liver, or if somebody has got vitamin K deficiency, because vitamin K deficiency, it helps in formation of the clotting factors in the liver. These are the acquired causes. Something wrong with the liver, liver has got chronic liver disease like cirrhosis, or somebody has got vitamin K deficiency, and one can have vitamin K deficiency because of malabsorption syndrome. Malabsorption syndrome. And that malabsorption syndrome, in which fat is not absorbed, fat is not digested, and it is commonly seen in hepatic obstruction, because the bile is not coming, bile salts are not coming into circulation. It is a fat-soluble vitamin. So if you don't have bile salt in circulation, the fat is not digested. So because of this indigestion, the person will develop vitamin K deficiency, and that will be manifested with decrease in clotting factors formation in the liver. So bleeding disorder in which clotting factors are not formed or acquired, those are either because of vitamin K deficiency or because liver has got chronic disease. There are genetic causes of deficiency of vitamin, deficiency of clotting factors. The most important are deficiency of factor 8. This is called hemophilia A. Factor 8 is called anti-hemophilic factor A. Deficiency of this factor 8 will lead to a disease called hemophilia A. It is X-linked hereditary disease. X-linked. Luckily, the females have got 2 X. If one X is diseased, luckily the other X is normal. So females do not suffer. Males, they are definitely going to have this disease because they have single X. So this is the X-linked disease. Some people, they have hereditary deficiency of clotting factor 9. Clotting factor 9. That is called, clotting factor 9 is called Crispus factor. It is also called anti-hemophilic factor. So if this factor is deficient, Genetically, it is also X-linked. If this factor is deficient, it is called hemophilia B. Hemophilia B. There is another bleeding disorder which is due to a component deficient called Willebrand factor. Von Willebrand factor. Von Willebrand factor is nothing but it is a component which is attached with the factor 8. Some people, it is not X-linked, it is autosomal dominant disorder. Very rare, of course, but one can develop, if you remember the function of von Willebrand factor, then you will understand why people they have bleeding. So these are the three important hereditary bleeding disorder. Number one, deficiency of factor 8, that is called hemophilia A, which is X-linked. Number two, deficiency of Christmas factor 9, which is called hemophilia B, and deficiency of another component of factor 8, which is called von Willebrand factor. Again, the deficiency of this factor will lead to bleeding disorder. So we talked about platelets leading to bleeding. We talked about clotting factors leading to bleeding. We talked about DIC. Now, another most important component which is normally needed in hemostasis is a normal blood vessel. You must have heard a disease called scurvy. Scurvy, which is basically because of deficiency of vitamin B, vitamin C. In this condition, the small vasculature are very fragile. Whenever you have bleeding, a trauma, to stop bleeding, you need to have a normal blood vessel. Those people having scurvy, although they have normal platelet, normal clotting factor, but still their bleeding is prolonged and they bleed. And that is because of weakened vessel wall, which is found in scurvy. It is not only found in scurvy, there are certain autoimmune diseases like Henoch-Schönlein purpura, like in certain infection, bacterial infection, in which the vessels are damaged, one can have weakening of blood vessel. So remember, whenever you want to have a normal hemostasis, you need to have a normal platelet count, functional one. Number two, you need all the clotting factors intact in your body. Number two, you need to have a normal blood vessel. So, yes. So, I think now we call it a day. If you have any question, remember, I cannot reproduce everything which is written in the book, this is beyond the scope. I can only guide you, make things simple for you, oversimplified. I will only think of making things simpler for you, but you have to go through the book. It is the sea of the knowledge, depending upon how much you are interested. If you have any question, you can always ask. You are welcome. Okay, we call it a day. Goodbye. God bless you.